Valerie, I'm going to turn it over to Dr. Reyna for the next session.
And while I'm beginning to introduce people, maybe they can come up and join us on the podium here. We have a little parallel processing. Thank you all so much, by the way. I'm Valerie Reyna. As was just mentioned, I'm a member of the committee and a professor at Cornell and director of the Human Neuroscience Institute. I'd like to introduce our distinguished panelists. First of all, I'm going to introduce them all at the beginning and then call them up one at a time. Dr. Daniel Alford is a professor of medicine, assistant dean of continuing medical education, and director of the Safe and Competent Opioid Prescribing Education Program at Boston University School of Medicine. He's on the staff at the section of General Internal Medicine and director of the Clinical Addiction Research and Education Unit at Boston Medical Center. He's immediate past president of the Association for Medical Education and Research in Substance Abuse. Doctors Alicia Swartz and Steve Woloshin are both general internists. They're both professors of medicine and community and family medicine and co-directors of the Center for Medicine and the Media at the Dartmouth Institute for Health Policy and Clinical Practice, Geisel School of Medicine at Dartmouth. Their research addresses the excessive fear and hope created by exaggerations and selective reporting in medical journals, advertising, and the health news. They've worked to improve communication of medical evidence to physicians, journalists, policymakers, and the public. They co-founded Informulary Incorporated, a company that provides data about the benefits, harms, and uncertainties of prescription drugs. And finally, there's Andre Jones, who is executive director of the University of North Carolina Horizons Program, a substance abuse treatment program for pregnant and parenting women and their children. She is also professor in the Department of Obstetrics and Gynecology with a joint appointment in the Department of Psychology. She's an internationally recognized expert in the development and examination of both behavioral and pharmacologic treatments for pregnant women and their children in risky life situations. She's published over 165 peer-reviewed articles, and that probably says it all. All right, without further ado then, I'd like to invite the first speaker, Dr. Alford.